Dr. Shahin, please unmute yourself.
Hello, everybody. Do you have my voice?
We can hear you. You can go ahead with your presentation.
Okay. Hello, everybody. I hope you have enjoyed this program up to this moment.
Dr. Shahin, can you share your screen? Yes.
Yes. Thank you. On behalf of my dear colleagues, dear Professor Hassanpour and Professor Winton, and other colleagues, I would like to draw your attention to our study determining outcomes of complete forehead lift via blepharoplasty and temporal approach, a study that has been conducted in Shaybeshti University of Medical Sciences, Tehran, Iran, 15 Khordad Plastic Surgery Center. I'm greeting you from Iran, and as the introduction, as you know, the upper third of the face significantly reflects the sense of beauty, youthfulness, and health to the observer, and therefore in recent decades has been the target for many different rejuvenating interventions, both surgical and non-surgical. Due to close continuity and correlation of the forehead, eyebrow, and eyelid complex, achieving optimal results will require simultaneous treatment of all three elements. The upper face has a great impact on impression of emotion. As you see in this picture, brow changes seen with aging may also communicate an unintended feeling of sadness, fatigue, or even anger. Both intrinsic and extrinsic aging affect the skin and its ability to adjust well to underlying volume loss. As you see in this picture, the patient looks older on his left side, and the reason is that he is a truck driver in Mojave Desert and has more pronounced photoaging and elastosis on the left side, which faces the driver's window. Also, eyebrow position and shape has great impact on personality and facial identity, and not only determines the overall aesthetic look of the face, but also serves as a key factor in facial recognition. In these pictures, you can see the photos of President Richard Nixon, the former president of the United States, at the right side. And also you can see the modified versions lacking either eyebrows or eyes, which shows the great contributions of eyebrows to facial recognition. As you know, the forehead, brow, and eyelid constitute a whole continuum. And so the upper eyelid issues cannot always be addressed in isolation with blepharoplasty alone. Brow position and contour are integral components of eyelid appearance. And as you see in these photographs, the patient on the left side shows marked dermatochalasis of both upper and lower eyelids and ptosis on the left side, which has been treated by upper and lower blepharoplasty on the right side. And you will see the descent of eyebrows after blepharoplasty operation. This has been the subject for our recent study by dear Professor Hassanpour and colleagues in our center that shows brow position should be explained to patients before blepharoplasty, and particularly in male and senile patients, a concomitant brow lift or internal brow fixation can help to stabilize the eyebrow in the proper position and prevent this complication. All of us are familiar with brow and periorbital aesthetics. It means that ideal eyebrow should have some characteristics, so that medial eyebrow should lie over the medial orbital rim. The lateral tail of the brow should be higher than the medial end. And also, eyebrow should rise gently, peaking slightly at least 2/3 of the way to its lateral end. And typically this peak lies vertically above the lateral limbus. And also brow aesthetics, as you see in this photograph by anthropometric measurements. And also I would like to remind the pathophysiology of forehead aging, which is closely related to the activity of depressor and levator muscles. As you know, the corrugator supercilii, the depressor supercilii, and procerus act as depressors of the eyebrow, whereas the frontalis muscle acts as the only elevator muscle of the forehead. The history of forehead and eyelid and brow lift goes back to about 100 years ago, when the French surgeon Passot performed elliptical excisions of the skin at the forehead and facial areas in order to perform facelift and forehead lift. And during the recent century, we have evolution of techniques from Passot to Hans, Hall, and finally Issy and Vasconez, who introduced the endoscopic brow lift, and also Noyes and Rorich, which improved and performed some modifications of the technique. At present, more than 20 surgical approaches and techniques exist for brow and forehead lift. So what is the reason? The reason may be due to the fact that none of them is perfect. An evolution of technique has emerged from older techniques which relied only on skin excision to more newer techniques and modern techniques which focus on dynamic tissue and muscle modification, complete release of periorbital attachments, and also mechanical fixation to bone. Although an endoscopic brow lift is now considered as the gold standard and has gained much popularity among many surgeons, both in North America, Europe, and also in our country, including me and my colleagues, but it has some limitations. For example, it has a steep learning curve, and it needs high-tech and expensive equipment, not accessible everywhere. Also, it is technically difficult in long and high-arched forehead, and not suitable for patients with thin hair or male pattern baldness. Also, the endoscopic brow lift does not address eyelid problems at the same time.